Hi everybody, my name is Sheereen Brown. I'm a senior business analyst here at the Task Force for Global Health. I'm an alumna of Georgia Tech, and I finished in the School of Industrial Engineering with my undergrad in IE in 2013, and then also got my master's in health systems from the School of IE. I finished that in December of 2014 and started working here at the Task Force for Global Health in February of 2015 and have loved every minute of it. When I was an undergrad, I had different internships with larger manufacturing companies, and even though the people were great on the teams, I wasn't really sparked or inspired by those work experiences, either working in very specific supply chains for building airplanes or consumer products. And I was doing some research on my own and was also talking to my older sister who got a master's in health systems about her experience, and figured out that that was a really great path for me. But I also wanted to participate in something that could give me an international horizon, and I saw that health systems was a really great connection to moving into the field of global health. Oh, my current job is so exciting. I tell everybody that I have the best job, and it's really because I get to do really impactful work all over the world. So I get to meet with people who are eradicating diseases in sub-Saharan Africa, or are trying to figure out new ways to codify data to understand how to get supplies to disaster areas in either Europe or Latin America. And what's so exciting about my work is that I get to travel to these places and I get to meet the leaders in global health who are working to address these challenges all over the world. And so it's not just sitting in an office, working at a computer, but it's getting out into the field, meeting the people who are really on the front lines, trying to make the world a better place. One of my favorite projects that I've ever worked on is the workforce allocation tool, and it uses an optimization model to effectively allocate healthcare workers across countries in sub-Saharan Africa. So currently there's a challenge in this context because there is a lack of healthcare workers at all levels, from doctors and nurses to dentists to midwives. And so the workforce allocation tool, or WOW tool as we lovingly call it, uses that underlying optimization model logic and allocates the healthcare workers in the places around the country where they're most needed in order to meet the needs of the Ministry of Health and ultimately the people of whatever country this tool is implemented in, whether it be Tanzania or Zambia, Mozambique. It really is an IE solution to a very tangible problem in sub-Saharan Africa. So I came to the fields of global health pretty late in my academic career. It took me almost all of my undergrad and then my master's to get here. But I wish there had been someone my freshman year to say, these are all of the things that industrial engineering can do. These are all of the applications. And I think that it's really important that you see this video, but also that you do your own research. So talk to the professors in the School of IE, specifically the ones that are working in health and humanitarian systems. Read their research papers online, go to coffee with them, ask them about what they're doing and how they're applying IE to meet these global health and humanitarian challenges. I say stay abreast of current events and issues. Global warming, the global migration from the global south to north. Be aware of what's happening in the world because IE often has a solution for these very large global problems. And then think creatively about what those solutions could be. I mean, I never thought when I was a freshman that I would be working on a project that was done in conjunction with the Georgia Tech IE department to help solve a major global health challenge in a whole different continent, but I am. So just consistently, continuously think about these wild pie in the sky ideas about how IE can be applied.